Hello everyone, welcome to Study Pharma. This is gonna be part 2 of the previous video, that is routes of administration of drug. The routes can be broadly divided into two, which is local and systemic. We've already discussed the local route. Now this is gonna be the systemic route of drug administration. So what do you mean by systemic route of administration? The drug administered through systemic route is intended to be absorbed into the bloodstream and distributed all over, including the site of action in the circulation. The local route was for only the localized lesions, but the systemic route means all over the circulation the drug is intended to be absorbed. So it can be further divided into the enteral, parenteral, cutaneous, inhalation, and nasal routes. Now let us discuss in detail the enteral route. The word enteral means via GIT, which is the gastrointestinal tract. Via the GIT, the drug is absorbed into the blood. It can be further divided into oral, sublingual, and buccal, rectal. The oral route. It is the oldest and most common mode of drug administration. PO is used to indicate oral route of administration. A wide range of oral dosage forms such as tablets, capsules, liquids, solution, suspensions, syrups, elixirs are available, which you might already be familiar with. The advantages. It is safer and more convenient as it can be self-administered. That is, we do not need an assistance. It is painless, cheaper. Now the disadvantages. The action is slow, so it is not suitable for emergency situations where you need the drug to be absorbed at a faster rate. Unpalatable drugs are difficult to administer. What do you mean by unpalatable? Just means that the drug has unpleasant taste and smell. It is not suitable for unconscious, uncooperative, and vomiting patients. Drugs get destroyed by first-pass metabolism. That is, the drug is transported to liver via portal vein. So that means there is less bioavailability. That is, the absorption of drug is very less. Also, the drugs get destroyed by the gastric juice. The second one, which comes under the enteral route, is the sublingual and buccal route. In the sublingual route, the tablet or pellet containing the drug is placed under the tongue. This allows the drug to diffuse into the capillary network and therefore enter into systemic circulation directly. That is, the drug gets absorbed into the sublingual mucosa. So this has an advantage, that is, one can spit the drug after the side effect is obtained. Example would be glycerin trinitrate, isosorbide. In the buccal route, the dosage form is placed between the gums and inner lining of cheek and is absorbed by the buccal mucosa into the systemic circulation. Now let's see the advantages of both sublingual and buccal route. The absorption is rapid. We can quickly terminate the desired action after getting the desired action by spitting out the drug. The drug directly enters the systemic circulation without the effect of gastric juice and first-pass metabolism, and it is economical. What would be the disadvantages? Again, the administration of unpalatable and bitter drug is difficult. There can be irritation of oral mucosa. Administration of large quantity is difficult. Now let's move on to the third, which comes under the enteral route, that is rectal route. So mainly here, the drug is given as suppositories or retention enema for systemic effect, such as diazepam, ergotamine. The advantage of this route is that it can be given to patients who are vomiting or unconscious. It does not get affected by first-pass metabolism and gastric juices. As well as irritant and unpleasant drugs can be given. The disadvantages are it is inconvenient, slow action,